Good morning, everyone. Okay, imagine this particular scenario. You're in bed, you're sleeping, you wake up because your alarm clock goes off at 7 in the morning. You gotta get ready for your 8 o'clock class. Perhaps it's a speech class. So what you do every morning, as what you usually do, you go to the bathroom, you turn on the faucets, you wash your face, you dry your face a little bit because you know you have to brush your teeth. So then you open the medicine cabinet, take out your toothbrush, take out your toothpaste, squeeze a little dabble of it on, and then you begin brushing. You brush for maybe about a minute, maybe a minute and a half, maybe 2 minutes if you really remember the voice of your dentist or your mom or dad, and you finish brushing. You spit out, you rinse in on with your day, you get ready, you go back to your room, and then you get dressed and you go on with your day. But what is it that you forgot to do? You wonder, well, I didn't forget to do anything. This is what I do every morning. This is what I do. That's just how it is. Well, you did forget to do something, and it's very important, and it's very crucial. In the words of some college students, some high school students, junior high, maybe some elementary students, these words that they would say would be this. This was an epic fail. You forgot to floss. So that's what it is. So today, I'll talk to you about the importance of dental hygiene. More so, it'll be about brushing your teeth, but specifically, it'll be about flossing. Okay, so the points include this. For one, I will talk about the benefits of your dental health, the detrimental effects of not flossing, how to prevent these awful effects of not flossing, and finally advise you and urge you after hearing this speech, and then I will hope that you will have a better and clear understanding of how important that flossing is. Okay. So my first point is this, the benefits of flossing. Here are a list of statistics from website WebMD, reviewed by Dr. Brunilda Nazario, medical doctor. It says, a 2008 survey found that only 49% of Americans floss daily, and 10% never floss. It goes on to say that flossing is more important than brushing when it comes to gum disease and tooth loss. Gum disease and tooth loss, can you possibly imagine? It is a scary thought. Let's see here. So, I will see the benefits of, flossing, what it does, what it can prevent. Firstly, it prevents tooth decay. It prevents gum disease, prevents halitosis, prevents tartar buildup, reduces the risk of heart disease, yes, surprisingly. And because it reduces the risks of heart disease, or how it even happens, is because with not brushing, your mouth is of course filled with tons and tons of bacteria. And some of those bacteria can eventually get down into your cardio tissues, and then after that it can go into your bloodstream and could affect parts of your body, so it can go to your heart. Let's see here, and then let's see. After that, it can increase the chances of other heart disease complications. Okay, so now I'll go to my next point here. It's the detrimental effects of not flossing. Now, in it first, this can cause bad breath, can cause tooth decay, can cause gum disease, halitosis, cavities, and the awful gingivitis. Okay. Now, from a Colgate article that I read, it was another statistic that read, more than 75% of Americans over the age of 35 have some form of gum disease. Now, you may wonder what gum disease really is. And there's early stages or serious forms of it, but gum disease can be as little as swelling gums or bleeding gums, or for example, when you brush, your gums may bleed a little, or when you floss, your gums may bleed a little. So a lot of times when people see this, they get scared, and so they hesitate about flossing, and they just back away from it, like, oh, my gums are bleeding, so I'm not going to continue to flush, which is really the opposite thing of what you should do. Flossing more, say for example you're flossing and then you're bleeding, flossing more will help your problem. It will actually reduce the bleeding of the gums. So take for example, if you do have bleeding gums, then try flossing more. After a week or two, it'll cease, and then it'll get better, and you'll have healthy gums, and you'll just be a happy person. So then, I'll go to my third point: ways to prevent these problems. Obviously, you need to brush, of course. You can use any type of toothbrush. You've seen them all. You've seen the Colgate and the, all those different kinds of brands, and you have the mechanical battery-operated toothbrush. And what you want to do is you want to go in an up and down motion instead of a side to side. After some research of brushing your teeth, they say that brushing up and down is more beneficial than doing it horizontally. But anywho, you also want to use a toothpaste with fluoride. So there's many types of toothpaste, as you all know. And another thing is that, of course, obviously you need to floss regularly, at least 2 times a day. Let's see here. And with flossing, you want to do it not in just an up and down motion, but you want to do it in what dentists describe as a zigzag motion. So after you put that string up in your teeth, you just want to, perk it up a little bit. And then, of course, you want to see your dentist regularly. And doing this will, promote great health, dental hygiene and everything like that. So it's just a good thing. Everyone's happy. Let's see here. Now, so this over here, it's a problem that many people face, but there's many solutions to what you can do. I stated it already. It's brushing, flossing, and seeing your dentist regularly. Now, finally, I'll state in conclusion, I've already discussed with you the benefits of flossing, the detrimental effects of not flossing and having really good oral hygiene, and how to prevent the awful effects and problems of what can happen to you when you don't. Now, after hearing all this, I hope that you all will, I hope you all have a better understanding of how important brushing and especially flossing is to your dental hygiene. Now, there's a quote taken from Samuel B. Lowe, which is a professor of periodontology at the University of Florida College Dentistry. He emphasizes the importance of floss and says this: if you were stuck on a desert island and a boat could bring only one thing, you'd want it to bring floss. Thank you.
All right, David, what did you think?
It had a nice intro, the narrative detail, but she kind of was fumbling around with the cards and she was nervous, and it was very detailed, a lot of imagery. But it was just sometimes with the sources wasn't in the body, but there was at least one conclusion part. And she had a nice voice.
Okay. Yeah, I think the visualization at the beginning is kind of fun, and you get to the topic in an interesting way. I do think you get a little caught up in the minutia of all the things that are going on there in that visualization that you have at the beginning. And I know you're trying to create a little bit of suspense for the revelation of the topic, but you need to get to the point a little bit quicker so that it doesn't feel like you're meandering. Your goal, however, is nicely stated, and you have a very solid preview of what the content is going to be. In the body of the speech, I think you do a nice job signposting for the most part, so I didn't have any obvious issues there.